I'm going to begin this speech by saying that I am a certified nursing assistant. I do work in a hospital every day, so I wash my hands quite a bit, and I am going to demonstrate today how to properly wash your hands. I'm going to begin this speech by talking a little bit about the history of hand washing. It wasn't until about the 1800s that doctors discovered that humans carry microbes on their hands that can be passed from one person to the next. In 1847, a doctor by the name of Dr. Semmelweis discovered that medical students had a higher infant mortality rate than midwives did when delivering babies. He discovered this to be so because medical students were performing autopsies on septic patients, and septic patients basically just mean that they are infection-ridden. So these medical students would perform autopsies on these patients and then run over and deliver a baby, and these babies would end up getting infections that would cause them to die. When they started introducing proper hand washing techniques in between patients, the infant mortality rate definitely decreased. In today's culture, it's very, very difficult to think about your healthcare provider or your food service worker not washing your hands, but back in the 1800s and before, it was a very common practice. So now that we know a little bit about the history of hand washing, I'm going to talk a little bit about something that's dear to me because of my degree in public health, and it is what soap to use. In today's culture, antibacterial is everywhere. Everybody wants the antibacterial products. And I'm going to explain a little bit why I don't think antibacterial is as beneficial as just a regular hand soap. Antibacterial products most of them have their active ingredient is a product called triclosan. Triclosan is known to be an endocrine disruptor. It can be very dangerous when used in large amounts or used too frequently, especially for women that are trying to conceive, for women that are pregnant, for the elderly who have other chronic illnesses going on. It basically just affects the way your hormones are absorbed into your body or distributed throughout your body. So if you know how to properly wash your hands, just a regular plain hand soap will do the job just as well. So now that we know about the product, I am going to move over and demonstrate how to properly wash your hands. And what you want to do is you want to begin by turning on the water and getting it as hot as you can handle it, basically. You don't want to burn yourself, but you want to get it as hot as you can. And you basically don't want to touch anything once you've got the soap on your hands. So you want to try to get everything ready and accessible before you begin washing. So you turn it on and let the water get warm. And you're going to wet your hands. And then you're going to add a liberal amount of soap. You want enough soap to make sure you get a good lather. You're going to begin just massaging the outside surface of your hands and the palms of your hands. And make sure you have a really, really good lather going. You want to make sure all the surfaces are covered. Once you feel like you've accomplished that, you want to really focus on your fingers because that's where most of the microbes live, is under your fingernails and under your jewelry and on your fingertips. So what you're going to do is you're going to take one hand and you're going to scrub the palm of your hand with your fingernails. This will get the soap up underneath your nail bed. You're going to make sure you don't ignore your thumb as well. You're going to repeat the process on the other hand with your four fingers and your thumb. I have rings on both hands, so I'm going to move those rings around and make sure I have soap properly underneath both of those as well. And then I'm going to begin to rinse. You want to basically wash your hands for about 10 to 15 seconds before you begin rinsing. And make sure you get all the soap lathered off. A good lather is what I'm talking about when I say it doesn't really make a difference if you use antibacterial. The scrubbing will kill the microbes if you have any on your hands. Once you have your hands completely rinsed off, you will leave your water running. You will grab your paper towel and make sure you get enough your first try so that you don't have to go back for more. And you want to blot your hands. You want to make sure you dry underneath your rings, underneath your jewelry, and make sure you get your hands good and dry. You will then use your towel to turn off your faucet because there are a lot of germs that live on normal everyday surfaces that we don't think about. And then you will also use your towel to pick up the lid on a garbage can and throw it away. And then your hands are good and properly clean. So it may take a lot more steps when it comes to washing your hands properly than just running some water and some soap over them, but it does make a huge difference. Learning about the history, learning about the products, and learning how to properly do it will in fact help slow the spread of infection and disease. Things like the common cold, the flu, things that are highly contagious in your everyday life, this will make a huge difference. So that is my speech on how to properly wash your hands.
I knew it all wrong.